Good afternoon to all. Welcome. Thank you to those who are joining us again and those who are joining us for the first time. Our webinar today from the University of Miami Institute for Advanced Study of the Americas is about COVID-19 and the emerging crisis in Brazil. We know that Latin America is the epicenter of the pandemic today, sadly and unfortunately, and Brazil is the epicenter of the epicenter. We are thrilled to be able to welcome a guest speaker today, Professor Dr. Cesar Victora, who is one of the world's most renowned global health specialists and epidemiologists. Before we start, and I share a little bit about their bios, and Professor Michael Touchton, who's also with us again today, let me just make sure that you have all of the necessary instructions. Most importantly, please feel free to use the Q&A feature to send us questions, and a little bit later in the hour and a half that we're together, we'll be interactively answering those, so be sure to share them. And also make sure when you share your questions to please give us your name if you're comfortable with that, at least your first name, and the institution that you represent if possible. We will have a recording available to you as of tomorrow for this event at our University of Miami Institute for Advanced Study of the Americas website, www.mia.as.miami.edu. We'll be sharing that with you again on screen later today. I am Felicia Knaul, thrilled to be able to moderate and give you a brief introduction, and I am the director of the University of Miami's Institute for Advanced Study of the Americas, broadcasting here from IBIS House. So it is my pleasure and distinct honor to introduce our panelists, and then I'll switch over to a very brief presentation for you today to give an overview of what we're seeing happening in our region. Dr. Cesar Victora is Emeritus Professor of Epidemiology at the Universidade Federal de Pelotas, Brazil, where he has been a professor since 1977. He has a medical degree, and in 1983 earned his PhD in healthcare epidemiology from the London School of Hygiene and Tropical Medicine. Dr. Victora has conducted extensive research in the state of Rio Grande do Sul and other Brazilian states, and has worked as a researcher and consultant in more than 40 countries around the world. He has been an advisor to the World Health Organization as well as UNICEF and to many other international, regional, and national entities. His areas of research include maternal and child health and nutrition, breastfeeding, birth cohorts, social inequalities, and evaluation of health services, with more than 700 publications in those areas. That is a huge number. Dr. Victora holds a position of Level 1A researcher at the Brazilian Council for Scientific and Technological Development. He has honorary appointments at the universities of Harvard, Johns Hopkins, Oxford, and London, and sits on the editorial board of several journals. He was president of the International Epidemiological Association from 2011 to 2014, and in 2017, and I say this very proudly as a Canadian, he was honored with Canada's Gairdner's Global Health Award, being the first Brazilian researcher among its winners, and very, very well deserved. Dr. Michael Touchton, our second speaker today, is Associate Professor of Political Science and Faculty Lead for Global Health at our University of Miami Institute for Advanced Study of the Americas. Professor Touchton's research focuses on public policy for governance and well-being, especially in Latin America. He's the author of dozens of articles appearing in top social science journals, and most recently the co-author of Democracy at Work, Pathways to Well-Being in Brazil, published this year by Cambridge University Press. He works regularly with governments around the world to translate his research into policy, and the research of our team into policy from the Institute, and has received support from the Fulbright, World Bank, Hewlett, and others. His PhD is from University of Colorado Boulder, and we are thrilled, I am personally thrilled, to be able to work with Professor Touchton, making our institute click. I'm going to give you now a very brief overview of where we're seeing our data and the situation going in Latin America, and lead into what will be Professor Victora's presentation of 20 to 25 minutes, followed by Professor Touchton of about 15 minutes. And Professor Touchton will also take us a little bit through our website. Our website is there for you to navigate, to work with, and we'll be going through that again in a few minutes. So let me go ahead and share the screen. Again, COVID-19 in the Americas, the emerging crisis in Brazil, but I want to give you this overview and share that our work is a collaboration with a number of institutions, particularly in Mexico and across the University of Miami. And we're very grateful to the Miller School of Medicine, to the College of Arts and Sciences, and especially to the School of Communication that has done so much to make our work possible. These data, this image comes from the Financial Times, and I invite you to have a look at those infographics. They're among the best that I've seen in the world. And this is a longer infographic that dates back to February, the beginning of the pandemic. But this is just the more recent curve through to June 23rd. Latin America now is the epicenter because it has 51% of daily global deaths, yet only between 8 and 9% of the world's population. Brazil has 22% of global deaths. These numbers are overwhelming and very unfortunately growing. We can see that the United States is tapering off, although still a major concern. Europe, we're seeing major improvement, and India growing. Now, you'll see this also, data and images taken from the Financial Times. The bold lines are covering Latin America, the dotted lines, others, countries with which we can compare. These are 7-day rolling averages of new deaths. And what we're seeing is Brazil, just over 1,000 deaths per day, as of these data showing us, and surpassing the United States. Mexico, 752 deaths a day, also surpassing the United States. We see trends in Italy, trends in Spain on the downslide. But we're seeing upward swings in Colombia, Chile, Peru, Argentina, basically all the region, and in particular, Brazil and Mexico. Now we turn to data, very new data from the Institute for Health Metrics and Evaluation. I also want to encourage you to visit their website. They have just uploaded, as of yesterday for Latin America, different scenarios with use of face masks, with relaxation of physical distancing and social distancing policies. And as of today, my understanding is that all countries in the world, there's a global picture, are now up on this website. We contribute to that and support their work with our data from our observatory. So these are reported and projected deaths comparing the United States, UK, and Spain. You see the important downward swing. Again, the USA not by any means to be looked to as incredibly successful, still a high rate of daily deaths, and certainly major concerns in states like Florida, from where I am projecting today. United Kingdom and Spain totally on the downswing and reporting, very few daily deaths. But look at those curves in time compared to what we're seeing, and here we're comparing Mexico and Brazil. Very wide confidence intervals for Brazil, between almost 11,000 deaths per day by the 4th of August and 2.5 thousand deaths per day, 4th of August. That difference depends largely on how populations behave and how policymakers and health systems are able to respond with testing and other sorts of interventions. But regardless, under almost any scenario, what we're seeing is a consistent upswing in these countries of Latin America, particularly, but not only Brazil and Mexico, compared to the downswing that we were seeing and have seen in other parts, in high-income countries around the world. Now, particularly concerning, and I'm sure Dr. Victor will speak most about this, is Brazil, because of its position in the south and how the virus will behave under different temperatures and weather conditions. So this is a huge projected problem as we move forward. Now, what can be done about this? You'll see the IHME scenarios suggest that there can be reductions in the number of deaths that can be expected. And one of the main issues to think about is tests. They say testing, testing, testing. And so what you're seeing here are tests per 100,000 inhabitants of a variety of different countries. And what you're seeing is that Spain, the UK, and the US are well above any country in Latin America. Chile better than the others, Mexico, the worst, the lowest in terms of number of tests per 100,000 populations, then we're especially concerned about. Brazil, a close second, but generally a clustering of Latin American countries other than Chile. And something that we're beginning to look at is the percentage of daily tests that are positive. You do not want this number to be very high. It's an indicator that you're not doing enough testing. If you're doing enough testing, you should see only a relatively small proportion of the tests turning out positive. That's what the testing is about. That's how you get to the contact tracing. Now, unfortunately, what we're seeing again, here we have Peru, Bolivia, Brazil, Mexico. These are quite preliminary data, but they're all on the upswing or high in percentages compared to the United States, Spain, or the UK. So another thing to be particularly concerned about. Now, finally, turning mask use. These are very preliminary data. Again, this comes out of Facebook, working with what IHME has done with these data. What we do see overall is that Latin America seems to be answering, saying that there's quite a high percentage of people who always wear a face mask when they go out. Yet, when we compare across our region, again, something to be very concerned about is that Mexico and Brazil, the super epicenters, are on the lower end of the countries that we're looking at. In comes our observatory that provides, we attempt daily updates on public health and physical distancing policy, and we look at implementation not only at the national, but the subnational levels. We also look at population mobility avoided, and all of this measured since the day of the first confirmed case of COVID-19 in each country. Our public policy index builds off of the Oxford tracker. We cover 9+ public policy variables listed below. We have the plus because we've now drawn out obligatory face mask use and testing and are looking at that separately from the block of public policy measures that constitute physical or social distancing. And then what we do in our observatory, which is a little different, is that we have weighted this index and our analysis of the data according to the day in which the policy was implemented, giving greater weight to those who implemented policies earlier than others. The mobility index comes from Google. You want to see a curve that's as low as possible, reduced or avoided mobility being at its maximum in order to reduce contacts, avoid cases, and eventually reduce mortality. As you'll see when Mike takes you through our website, you can look not only at Mexico and Brazil at the subnational levels, but also overall Latin America here in terms of our index of public policy adoption. Mexico and Brazil performing poorly, only better than Nicaragua. When you look at this country by country, you see this very clearly again. Our Mexico and Brazil data, which are measured at the subnational level, show poor performance for a number of reasons compared to many other countries, most other countries other than Nicaragua in our region. And finally, on the population mobility index, unfortunately, a very similar story, that whereas we would like to see important reductions in mobility, which means curves that are lower down and flatter, not only are we beginning to see these curves heading upwards, going back to regular levels or standard pre-COVID levels of mobility, but also again, our super epicenters, Brazil and Mexico, are way high up on here. Their performance in terms of population mobility is substandard compared to other countries in the region. Again, here we see across the region, and only Nicaragua is performing worse in terms of avoiding population mobility. I invite you again to our website, ObservCovid.miami.edu, thanking our School of Communication for putting this together for us. You'll see more about this in a minute. I want to stop sharing my screen and at this point have the pleasure of turning this over to Professor Victora, Dr. Victora, who has done yet again what is some of the most important and interesting epidemiological research that I've seen in our world. Thank you, Cesar, over to you.
Thank you very much, Felicia. Hello, Michael. Hello, everyone. It's a real pleasure to be here and to present some results from our most recent research throughout Brazil. I'm going to take you through the history of our studies and then share some of the main findings with you. Can you see my screen? Is that okay?
We can see it perfectly. Go ahead, Cesar.
Okay, thank you very much. So we all know that official statistics based on reported cases, which are based on testing, which Felicia so clearly showed that we are not doing very well in terms of testing the population, but the official statistics will underestimate the magnitude of the pandemic, whether it is in terms of cases or in terms of deaths. Very few studies anywhere in the world have actual population-based samples. That is, go from home to home. Here's a picture of two of our field workers going from home to home and testing people in a random sample of the population in many different cities in Brazil. And even fewer countries anywhere have periodic surveys. That is, they have the same survey every 2, 3, or 4 weeks to track progress and monitor progress of the epidemic. Jeffrey Rose was my professor in London when I studied epidemiology, and he really impressed us, saying that we have dirty hands in epidemiology because we have to go down to the fields, to the homes, to the communities, to the favelas, to the different sorts of neighborhoods we have in our country. But we need a clean mind to understand and study the distribution and the determinants of health and disease in a population. So basically, this is our approach. We go from home to home. We select one person per household, whether it's a child or an adult, and that person is tested. We are using this Chinese test, the wonderful lateral flow test. It tests either IgM or IgG. It does not differentiate the two. There are several validation studies, including our own. Before we started the field work, we validated it, and we found that it has a reasonably good sensitivity. That is, it picks up 85% of the cases, and specificity is very high too. That means people who don't have the disease are also, they have the infection, are correctly classified as being uninfected. It's based on a finger prick. It's just very quick. It takes 15 minutes. When the 15 minutes while we are waiting for the test to show a bar, like it's showing on the two tests there, the first one is negative, the second one is positive. Those 15 minutes we use to carry out a short interview with the people. Just for us to take into account what kind of tests we're talking about, there are lots of different tests for COVID and for antibodies against the SARS-CoV-2 virus. So some tests are good for diagnosis at the acute phase, the red curve, for example. And some tests, like the one we're using, they only turn up positive about a couple of weeks, 10 to 14 days after the disease. So we're always getting a picture in time, which is a little bit back regarding the date of the test. But the advantage is that unlike the PCR and the virus tests, the antibodies tend to persist for much longer. So we get a better picture of the progression of the pandemic in a community. We started small, but quickly. Within 1 month from the first case being reported in our state, we're in the extreme south of Brazil. You can see the dark state there, right at the border with Uruguay and Argentina. That's where we are. And Pelotas is in the extreme south of that state. Within a month, we had set up our team, and we selected 9 sentinel cities. These are the regional hubs. They're the largest, most populous city in each of the state's regions, the sub-state regions, which are called intermediate regions. So we selected 9 municipalities according to this criteria, that they were the largest one in each part of the state. And we selected 500 people using multi-stage random sampling. And we did 1 survey round every 2 to 3 weeks. We now have done 4 survey rounds. The first one, we managed to test 4,100 people. We got better with time, and then we're now always reaching the 4,500 people that are our sample size. It has to be done very quickly. So you have to do it in 3 days. So that means that in some municipalities, there may be difficulties. I'm going to talk to you about some of these difficulties, but we managed to test the people now. We are getting pretty good at it now. We're really getting the full sample in all cities. And this is the result from the first round. This slide needs a little bit of explanation. We found very low prevalence. The red circles represent prevalence, and they are on the axis that is on the right of your graph. 0.2% prevalence was the maximum we got. Remember, other countries also have very low prevalence. Austria, Iceland, a lot of countries that did national studies also found prevalence below 1%. And we found a slight increase over time. Actually, the increase is statistically significant. You look at the error bars, the 95% confidence interval. And we also plotted that against reported, cumulative reported cases and deaths. We found that about 1 in each 10 cases, 10 infected people becomes a reported case. And that is a pretty strong finding in most places of Brazil. So the testing that is done is grossly insufficient and is underestimating the proportion of the population who are being tested, who actually have the virus by a tenfold difference. So it's really huge, and we have to take that into consideration. Brazil recently broke the 1 million reported cases threshold, which means that we have 10 million people. So whenever you read any statistic from Brazil, you multiply by 10 and you're much closer to the truth. We also test family members. If someone is positive, we test their family members. We find that about 27%, 30% of family members are also positive. But this is going to be published soon. Now, the big step was that when we did the first round of surveys in Brazil, the Minister of Health in Brazil, Dr. Luis Mandetta, who was pretty much pro social distancing and was really doing a great job in running the show, the COVID fight in Brazil. He asked us to do a national study. And then we said, okay, so how many regional hubs do we have in Brazil? We have 9 in our state. We have 133 regional hubs in the country. And then we said, let's go and do it. So this is a huge study. You know, I've been involved in a lot of studies. I think this is by far the largest one. Brazil is sort of 4,000 kilometers from north to south and about 4.2 thousand kilometers from east to west. And that's the distance between the extreme cities in our study. We have 27 states in Brazil. We took all the 133 regional hubs. We are studying 250 individuals per city, total sample 33,250. And so far we have completed 2 rounds. The last one ended yesterday. I'm going to show you some very preliminary results from that too, but most of my presentation will be on rounds 1 and 2, which took place in mid-May and early June. Just for you to have an idea, we have about 2,000 interviewers working during these 3 to 4 days when we attempt to collect all the data from all the parts of the country. That was a big challenge. This is fake news, official communication. Don't open your door to anybody who pretends to be a COVID researcher. It's amazing. This must have been spread by robots because it was all over the place. We're getting it from every municipality. And in our first round, these were the headlines. For those of you who understand Portuguese, they are self-explanatory. But in 20 of the 133 municipalities, our researchers were arrested and put in jail because of all the fake news. And in 8 municipalities, the police actually destroyed our tests. So we didn't do a very good job in the first round. Largely this was due to the fake news campaign, but also to poor communication between the Ministry of Health and the states and municipalities, because the role of the Ministry of Health was to support us in warning the states that teams of researchers would be coming in. There's also some cities that were in lockdown, so they wouldn't allow people to circulate and all sorts of different causes. But remember, when the minister who commissioned the research, Dr. Mandetta, by the time we were actually in the field, there had been a new minister, and that one had also quit, both because of conflicts of opinion with President Bolsonaro. And so the minister was ministry was changing very rapidly, and that affected the communication. The ministry is now on board, so really happy to tell you that the ministry, these issues have been solved, and the ministry has been supporting our study, not only financially, but also logistically. So these problems were overcome. Well, if Felicia says that Latin America is the epicenter of the pandemic and Brazil is the epicenter of the epicenter, well, I'll tell you what, the Amazon region is the epicenter of the epicenter of the epicenter. Of the 15 municipalities in round one, where we managed to carry out at least 200 tests, 11 were in the Amazon. 2 were in the Northeast, Fortaleza and Recife, and then Sao Paulo and Rio in the Southeast. And this is the number of tests. This is very rough, very preliminary. In the first round, in every round, we tried to examine 33,250 people. In the first round, we managed to test about 25,000, 347 were positive, 1.4%. Second round, 2.4%. Third round, just preliminary data, we managed to reach the adequate sample size in all but 2 cities. So it was really a great job, and about 1,000 positive tests. So prevalence is increasing quite rapidly. Remember, these are 2-week intervals. And in the first round, all the 6 cities with the highest prevalence, they were all along the Amazon River. I was really surprised with this behavior of COVID pandemic in Brazil, because everybody thinks that the colder part of the country is like where I live. It's going to be 8 degrees tonight here. So it's, we're going into the winter. Everybody said, oh, you're going to have many more cases here. Whereas people thought, oh, tropical areas are spared because this is a respiratory virus. It doesn't really like warm temperatures. How wrong we were. Everybody was wrong in that respect. So that's one of the reasons why it's really so hard to predict how an epidemic will behave. So this was the first wave. This is the second wave of the 15 cities in Brazil with the highest prevalence. 12 were in the Amazon or its tributaries. And here is showing the prevalence in the 2 waves. The dark red means higher prevalence over 10%. So there's clearly something happening in the Amazon region that make it so easy for this virus to spread. Well, on the left, this is a picture of how people travel in the Amazon. They travel in riverboats. Trips take anywhere from 6-8 hours to 3 or 4 days. People are crowded in those boats. And what's happening in Manaus, the state capital, is that cemeteries are just completely full. They're really having trouble to find more, to dig in time to bury all the people who need a grave, all the dead people, unfortunately, who need a grave. It also takes us to the picture on the right is a real fantastic picture to illustrate the severity. We're not talking about numbers, we're talking about dead people. Each little rectangle there is 1 dead person in the city of Manaus. The theory we have, it's a hypothesis that some colleagues from the University of Amazonas have raised, is that there's a lot of industrial presence of Chinese industries in Manaus, because Manaus is a hub for tax-free industries in Brazil. And the Chinese must have probably brought the COVID to Manaus very early. And then it spread through boat travel. This is also for my colleagues from Amazonas. The green line is the excess deaths compared to last year. And the dashed blue line is the officially recorded COVID deaths. So it seems that a lot of excess deaths are happening. Many of these are likely due to COVID, and they're not being recorded. Now, going back to Brazil. So the cities with the highest prevalence, I told you 12 of them in the Amazon. Then we have Fortaleza in the Northeast. We have Maceió. We have Salvador, Bahia, and Rio. São Paulo is a little lower than that. São Paulo has the highest number of absolute deaths because it's such a huge city, but we're all talk about population-based data here and dividing deaths by people. Well, the interesting thing is that the north is still going up between rounds 1 and 2. The darker bars are around 2. But the northeast is where things are really picking up. The northeast will soon be the epicenter of COVID in Brazil. One of the advantages of having a survey like ours is that we can look at inequalities. We actually know who is tested and what is their race or ethnic background and what is their socioeconomic condition. And here you see that the indigenous populations in Brazil are much more affected than any others, and whites, not surprisingly perhaps, are much less affected than the average. And this is socioeconomic condition. The poorest are much more affected than the richest. I think this is the only place in the world where we have statistics like this from a population-based study confirming the huge social divide that affects Brazil and other parts of Latin America. We are very careful about giving data back to policymakers. So this is an infographic, the city of Tefé in Amazonas, a city that has 20% prevalence. It has 21 times more infected people than confirmed cases. In Amazon, I talked about 10-fold difference before. Now we're talking about, you know, a 20-fold difference in the poorest parts of the country, because there the deaths are just not being recorded properly there. Having said that, even in spite of all this, the under-registration, there's a very strong correlation between prevalence in our study and the reported death rates. You know, the correlation is very high, so the data, our data have face validity because they are matching other source of data. When we look at what happened in Brazil, and I'm coming close to the end of my talk, the north really took off, the brown line, followed by the northeast. And where I live is the green line way down in this graph. We're still having very low prevalence, as I told you from the previous study we did in the state. And we continue to do the study just in the state. And so far, we've been quite lucky because we have had low prevalence. Now, this is a little difference. This is the daily number of deaths, and this is modeled. And you see that the north, which is on the top, is already dropping. So some either partial herd immunity or social distancing measures were implemented and lockdowns in many cities are helping lower the curve in the north. The northeast is still going up. The southeast, which is a purple line, going up. Center west is sharply going up at low levels, and the south is going up slowly. So if I go back one slide, this is almost cumulative numbers, but this is sort of a real time what's happening in terms of deaths. Now, this is a piece of research. I had support from many different parts of Brazil, from many different universities, and from private donors, as well as from state and federal governments. And I would like to end by introducing Michael's talk. I know he's going to talk about social distancing measures. On the left bottom is our president. Every Sunday he goes out to greet supporters without masks, takes selfies, touches people, is openly against social distancing. On the upper right, we have the state governor. On the left is a young guy from Pelotas, by the way. And on the right, we have the president of the Pelotas University, who's also an epidemiologist, Pedro Alau, who has been leading this research project as well. And every time we have a new survey, we have a live Facebook session in which the state governor and Pedro discuss the next steps, what needs to be done, and so on. So on the right, we have a governor who's basically doing the right thing, listening to science, enforcing social distancing with a flexible system that goes, cities move up and down in terms of social distancing according to actual data. On the left, unfortunately, we have someone who's not very keen on science, not very keen on data. And I'll end here, and I'm happy to discuss further with you, and I'm sure Michael's slides will provide further insight on the policy aspects of this pandemic that we're all having to deal with. Thank you very much.
Thank you very much, Professor Victora. That was excellent and a perfect lead-in into my presentation. Once again, I'm a political science professor at the University of Miami, and my work focuses on governance and public health in Latin America. A lot of it focused on Brazil. In this case, we're seeing an absolutely devastating pandemic in Brazil, where it is now the epicenter really in the world. More than 1,000 deaths a day and growing. And as Dr. Victora just mentioned, President Bolsonaro hinders key policy responses and opposes many of the measures that would be designed to keep people distant from one another, to limit mobility, and then to keep them safe in a reopening. As Brazil reopens, testing is low, contact tracing is difficult, and many other countries in the region test more on a per capita basis. For example, Chile and Peru test about 5 times more, according to Johns Hopkins data. The USA tests about 8 times more, and there's a problem with testing in the United States. Nevertheless, in Brazil, it's very, very low. Dr. Victora's study is one of the few large ones that's making headway in this respect. As both Drs. Knaul and Victora tell us, the likelihood of the pandemic getting worse before it gets better in Brazil is very, very high. These are projections I'm showing from the Institute for Health Metrics and Evaluation at the University of Washington. And where we are now is the red point of deaths per day of a little over 1,000. But as you can see on the right side of the screen, the projections, this is if restrictions are eased, go up to almost 5,000 per day, projected, of course, by the middle of September. If, however, masks are put in place in all public places, mask wearing requirements, the peak is expected to be in the middle of July, and then the daily deaths slowly decline into about 500 a day by the beginning of October.
Internet.
Oh, hold on. Sorry, I'm going to show you a little bit of our website in just a minute here. But in Brazil, what we see is that most states acted late, several weeks after the first cases in the country, and they implemented very minimal, incomplete measures to promote distancing. Now, states have begun to reopen, many of them without necessary protections for the population. These states must strengthen their policies or face disaster. Hold on. I'm going to take you to the website and show you some of these policies after I give you a general overview of what we're doing and how we're doing it. Dr. Knaul covered well. Here's the University of Miami's COVID-19 Observatory for the containment of COVID-19 in the Americas. And you can see on the front page that Latin America, as we describe it, is the world's hotspot for COVID-19 infections and deaths. On the top row here, you can choose to see public policy, mobility data, and soon data on masks and testing separated out from policy measures for each country and for the Americas as a whole. We owe an enormous debt of gratitude to the University of Miami School of Communication and several of their website wizards for helping us to create this site as quickly as we could and to automate it with interactive graphics. I'm going to take you to Brazil right now. On each item, we have an opportunity to select between English, Spanish, and Portuguese to reach the most people possible across the region. And we have updates roughly weekly with a set of results and analysis from the new data that we've collected. These data are daily, but we update the website with these new materials as quickly as we can. This graphic here shows the public policy index performance of each Brazilian state over time. As you can see at the bottom left corner, states waited on average 3 weeks before implementing any policies. And if we look at a state over time, like Goiás, you can see where they implemented policies, relaxed some, re-implemented others, relaxed again to arrive at their current position. Others acted a little differently and more effectively, like Santa Catarina, which had much stronger policy responses in terms of physical distancing, but then has now opened up very, very quickly. And it's possible, as Dr. Victora described, for Rio Grande do Sul, for states to open up in a safe way. But most of these states are not opening up safely. Let's scroll down just a little bit. We have the state's population mobility over time. You can see the worst performing state right now, Mato Grosso do Sul, has population mobility that's only 14% lower than normal prior to the pandemic. Other states are doing much better, between 40 and 50%. But in many cases, the public policy response corresponds to the mobility response. If distancing measures are implemented and the public complies with them, mobility tends to fall. So soon we'll have graphics here as well covering mask use and testing. Now I'm going to take you back to the PowerPoint. And what we're seeing among patterns, more so in Brazil than in Mexico certainly, and more so than in most other countries, is that partisan polarization explains a lot of the differences in responses from the different states. The top performing states are not the richest and the lowest performing states are not the poorest, but governors who oppose Bolsonaro tend to act more forcefully to contain the disease than those who do not. Of course, there are some exceptions, but I can show you on this map the public policy stringency by state, where lighter colored is better performance. And these states in the Northeast tend to outperform states, especially in the Center-West, on implementing policy measures for distancing. For mobility, it looks very similar. The best performance, which is the greatest reduction in mobility, occurs on average in the Northeast. So there are other performers that are high on the rankings like Rio de Janeiro and Santa Catarina. If you put these together into quartiles, you can see the states in the Northeast that I mentioned in this upper right quadrant, which are the better performers. The green color indicates that these have governors on the political left or center left that are opposed to Bolsonaro. The yellow states are those with centrist governors by political party, and the red states, primarily down in the lower quadrants, are those with governors on the right and center right, many of whom tend to support Bolsonaro. In this case, politics and mobility go together, and we have strong performing states that I just showed you, like Rio de Janeiro, Bahia, Ceará, Pernambuco, Alagoas, and several others. And some states, especially in the center-west or in the center of the country, that perform worse. Finally, in face masks, the pattern is similar still. It's not quite as obvious as with mobility or with public policy for the other indicators, but the Northeast tends to outperform some states in the center and center-west in particular, but also in the North. Ultimately, this shows us that public policy is critical. We know that already, but we also know that a fragmented response stems from the lack of federal leadership on this topic. Bolsonaro will not help during this pandemic. The federal government is facing great difficulties in leadership right now, as Dr. Victora described, especially for the health ministry. And as a result, states and cities lead the policy response. They acted late, some acted more forcefully later, but they're all reopening quickly. These governments must require masks, they must test citizens, they must trace contacts if they are to avoid catastrophe. And we sincerely hope that happens. But we haven't seen a lot of evidence of that yet, and it presents a scary situation for projections into the future. With that, I will pass the presentation back to Dr. Knaul, and we will await your questions, which you can ask in the Q&A section on the chat, or just the Q&A section, and we can address them as they arrive. Thank you.
Mike, Cesar, thank you so much. I have to say that that was tragic and tremendous. Tragic in terms of what we are seeing, tremendous in terms of the science and the research and the importance, Cesar, of what you and the team are doing from Pelotas. We have several questions, and let me also say that some people have been sending more technical questions, direct and in particular to Dr. Victora, and he is an expert Zoomer who is answering you directly. So please feel free if you have more technical questions around the survey and the details, epidemiology, go ahead to share those on the chat. Let me share two that we have right now. Either of you, I think, are more able to answer this by far than I. Cesar, you can obviously say we should punt on. But the first one from Daniel Suman is, who do you believe was behind the fake news campaign? And then also from Danielle, he asks very directly, do you think that the International Criminal Court might hear a case against Bolsonaro for crimes against humanity after this?
Well, thank you for the question. Since the presidential elections 1.5 years ago, there's been a sort of organized fake news lobby involving, mass distribution of fake news. Initially, there's an open case in the Supreme Court in Brazil now accusing some of the Bolsonaro supporters, including federal members of the federal Congress of Parliament, to have set up a very intensive fake news campaign. I can't say that they did it, no, but it looks pretty professional. It was spread through robots and throughout the whole country. I'm not blaming A or B or C. Even as I mentioned, the Ministry of Health is partly funding our study. So I can't say who was about it, but we know who's against social distancing. We know who's against the statistics that are being disseminated. There have been changes in the way the deaths are reported, changes in a way that minimize the number of deaths recently by the Ministry of Health. So it's really hard to say who's behind it, but I do have a few suspicions. Regarding the second question is a harder one to answer. Any leader, not only president, any leader who opposes science, and that includes a president from a big country in the north that you may know better than I do. Any leaders who oppose science and who endanger the lives of their population, their citizens, is potentially liable to be prosecuted. So, it's been hard here because every weekend the president goes out. There's been now the governor of Brasilia now has told the president that if he goes out again without a mask in public, he will be fined, because he will wear a mask sometimes, but then he gets close to his supporters and pulls down the mask and takes selfies and hugs people and so on. So that's a really bad example. It's very, very, very contradictory to what one, as a scientist or a public health person, we would like to expect. I'll let Michael comment on that too.
Certainly, thank you. I do not have funding from the Brazilian Health Ministry, although I've tried in the past, but I'm perhaps in a position to say a little more and speculate a little more. Like Dr. Victora says, we don't know and we can't know right now who's behind these campaigns, but I am almost certain it's supporters of President Bolsonaro on the political right who do not believe that in some cases even the virus is real, but they certainly don't believe in the distancing measures that some governors and mayors have implemented. They don't believe in the use of face masks, and testing and tracing are not part of their vocabulary. So from that standpoint, you can also see big partisan divides in terms of the perceptions of safety among the population. Ernesto Calvo and Thiago Ventura have a new working paper out that has a framing experiment with the survey. And effectively, if Bolsonaro in this framing tells you it's dangerous, his supporters think it's dangerous. If he tells you it's safe, his supporters think it's safe. And the opposite. The polarization is so extensive in Brazil, and just like in the United States, people receive their messages and they accept them without questioning in terms of supporters of the president. In this case, they're probably behind this disinformation campaign.
So we are getting more questions than I think we have ever received, and several from the press. So let me turn to the press questions, and Cesar, they're largely directly directed towards you. We have a submission from Naira Hofmeister, and I don't know, Naira, which type of media you're from, which company you're from. If you can send it to us in the chat, please do. But the question that was posed is, throughout the 4 waves of the research conducted in Rio Grande do Sul, the results indicated that the epidemic was stable in the region. However, in recent weeks, hospitalizations by COVID-19 increased, raising the alert for collapse of the health system.
Yes.
Is the research picture still valid given and in the face of this new situation? What can explain these 2 different realities?
Yes, that's a good question. The fact that we have not had a huge number of cases, that prevalence is still low, doesn't mean that it will not increase in the future. You know, we don't have a single pandemic in Brazil. We have several different pandemics. There are different stages of the pandemic in different places. Whereas in the north, perhaps and hopefully the worst is over. It's still really bad, but the worst is over. It's still going up in other parts of the country. In Rio Grande do Sul, we had very high number of cases and deaths in half a dozen cities in meat processing plants. So very localized. If you look at all of Brazil, the highest death rate for COVID is one small city in Rio Grande do Sul, where just about everybody works in a meat processing plant. So the slaughterhouses are a hotspot, and that it has affected the transmission. So we really don't know. You know, I think this epidemic is very, very hard to predict. I see lots of models, and some may end up being correct, but there are so many unknowns. You know, the unknowns are the fact that we have the super spreaders of COVID. There is one person who's very, very highly infective, who will infect 20 or 30 or 40 people. And we have some people who have COVID and don't infect anyone. And just by bad luck, if a super spreader is in a meat processing plant, for example, that person can then contaminate and infect all the working colleagues. So it's really hard to say. You know, we're keeping. The other thing that I just wanted to say, Naida, is that our antibody tests give an answer that's 2 weeks old. So I tell you that today I get 1%. That was 2 weeks ago. Therefore, it's very useful in the long term, but it's not, you know, it doesn't respond quickly to a sudden surge in cases. We have to take that into account.
Cesar, we have another question from the press. Let me also say that I'm thrilled to know that we have some of the trustees of the board of the University of Miami listening here with us, including Ambassador Cobb. And so we're thrilled that you could join us. Again, please feel free, all of you, to share questions. The next question, Cesar, is from Rafael Garcia, science writer with O Globo. I noticed you showed advanced data for the third round of your seroprevalence study. I see your data is pointing to an increase in prevalence from 2.4% to 2.9% throughout June in Brazil. How worrisome are these numbers? Now that you have 3 points in time, can you say how much we are able to flatten the curve in Brazil and whether we are still on a runway trajectory upwards in the chart?
No, I think these results are very worrisome. You know, these are very initial. They're really hot off the press because we finished data collection last night. But they do show an increase. What we are observing is that a lot of cities, for example, in the interior of the Northeast, are going up rapidly. So the pandemic, as I said before, we don't have one pandemic, we have multiple pandemics. We are a long way from getting it over in Brazil. It's very likely that we'll continue to have to face COVID for a long time. Our best hope remains to be in a vaccine, whether when a vaccine is produced, it will go to the neediest, poorest countries in the world, or whether all the doses will be taken up by the high-income countries. That's a big question. We really have to worry about that. But right now, my answer to the colleague from O Globo is, I am very worried. You know, I remain very worried, and I think the worst is still to come.
Thank you, Cesar. I wish we were sharing more positive notes, but we're sharing the truth, the evidence, and we have several listeners from our regional and international organizations. Let me share the first, Oscar Mujica from Pajo, who shares that this is a terrific presentation and congratulates you, which we all do. And he asks, from the survey rounds in Brazil, do you have information about prevalence among symptomatic and asymptomatic cases?
Yes, we do have information on symptoms. We're still analyzing them, but obviously there are, you know, not everybody who has COVID has symptoms. What we found in particular in Brazil is two interesting features. One is that young kids are slightly less likely to be infected than older people, but not much less likely. Earlier studies from China, from Italy, from Spain showed that kids were relatively preserved from infection. We did not find that. They're still getting a lot of infections, but the kids are mostly asymptomatics. Well, also because sometimes young kids have more difficulty in expressing symptoms than older people, but we do find a substantial proportion of asymptomatic people. We're still going through the data analysis. Oscar, I know Oscar well. Oscar, as you can imagine, doing a round of survey every 2 weeks with 2,000 interviews in 133 cities in the 27 states takes up a lot of our time. So the data analysis are going a little bit slower than that. But we do have a substantial proportion of asymptomatic people, which is really concerning because people are transmitting without having symptoms.
And I just want to highlight one thing that you said that I think is just so important, Cesar, the idea for children that they may not be able to express their suffering in ways that will allow us to respond. The same is, I think, often true for the poor. You showed us those data. They don't have necessarily the same access to communicate. And the same often we see with gender bias and bias, not only against women, but against all genders. So this is, of course, something to look at. We have another press question from AP, Joshua Goodman. Thank you, Joshua. So glad you could join us. The projected surge in daily deaths that Dr. Knaul provided at the beginning of her presentation, that's me, are staggering. If those estimates of future death prove true, will the mortality rate of the virus have surpassed what we saw in other parts of the world? If so, why?
Okay, that's a really good question. If you divide deaths by reported cases, yes, what we call the case fatality rate is really high in Brazil, something like 7% or so. However, we epidemiologists prefer to relate deaths to infections in the community based on surveys. And then if you look at that, then based on the estimated number of infections that we have in a country, we are getting less than 1% die. Having said that, we are also undercounting deaths, as you saw the cemetery in Manaus, you know, and the very nice graph from the Amazonas researchers who say, you know, we're just many more people are dying, and just a few of those are being reported as COVID deaths because they have deaths which are reported which are not properly investigated, which are reported as other types of pneumonia or respiratory infections. And so we're definitely undercounting deaths as well. Brazil has a very strong national health service. It's been underfunded for at least a couple of governments, previous government, but everybody's insured. So that's an advantage of countries like the US, where you have people who are not insured, or you have illegal immigrants, irregular immigrants who are not able to use the services and so on. So I think we're doing a better job of handling deaths and putting people in intensive care units, although some are overflowing. In most of the country, they are not to full capacity yet. So I think Brazil will do better than other low and middle income countries. But the final answer to our true case fatality will take a while until we get all the numbers straight.
And John, let me add to that, that for example, if you look, and I didn't show these data, but we have them from the OECD showing case fatality rates across a number of countries. For example, Mexico is extremely high, and that's actually because they're not testing. So if the number of cases is very low and you're basically using all your tests in tertiary hospital settings, then you're going to get an extremely high case fatality rate. So this can be extremely misleading, and it's largely to do with testing. Now, I think in some of the spirit of that question, if I'm reading it properly, will we see higher mortality rates in the future as we see the pandemic, the disease surge across low and middle income countries? I think without doubt, yes, because even though some countries like Brazil or Mexico have a stronger system, hospital system, it's still insufficient. But we're seeing many countries overwhelmed by this disease that don't have that kind of access. Right. And even with some developments like the use of steroids, we're going to still see a huge problem. Furthermore, something that very few people have been speaking about is I think we're going to see a lot more deaths in the home and exposure of caretakers, completely unprotected caretakers, mostly women, young women, old women, who are going to be exposed over long periods of time in ways that caregivers were not exposed in high-income countries, and no one is measuring what those what that could mean. We have a number of questions. We had said usually we go 1 hour and 15 minutes, but we left a little bit more here, and I'm glad we did, because we are still getting the questions coming in. Mark Connolly, Mark, it's so great that you are with us again. Mark is a dear friend. We worked together in Guatemala too many years ago, and now in the UNICEF Honduras, and he's been with us on a couple of webinars. And Cesar, Mark is asking, are there any major lessons learned from chikungunya that are being applied successfully against COVID across Brazil?
Well, as you know, Mark, you know, we've been hit by one epidemic after the other in recent years. First was Zika. Zika, which was mostly a mild disease, but with a terrible effect on the fetus and on microcephaly. Then we have dengue for a while, you know, 7 different waves of dengue. And then we had chikungunya. Zika, dengue, and chikungunya have one thing in common. They're transmitted by vector. The actions that need to be taken are basically environmental health actions in terms of getting rid of the reservoirs or mosquitoes proliferating. We've spent a lot of money on that, but still, they're still coming. And one of the concerns we have is that someone who has chikungunya, for example, which is a, a hard disease. It's unlike Zika, it's very symptomatic. May get in sequence, may get COVID. What will be the synergistic effects on that on someone? Would that increase death rates? We don't know what that can happen to the immunity of people who had more than one viral disease in a short time. We know quite a lot about dengue, and dengue is a sort of a peculiar disease that if you have a certain serotype after the original serotype, you actually have more disease rather than less disease, you have more severe episodes. And that's when you had the hemorrhagic dengue. We're struggling with these diseases. They come and go. And I'm not sure there's any lessons that have been learned other than we have to improve our surveillance systems. By the way, the surveillance system in Brazil compared to other middle-income countries is actually pretty good. There's been a lot of effort in public health in Brazil in the last 20 years, particularly in earlier governments, there was a real great effort in building up the health infrastructure, the registration of deaths, the surveillance systems, and so on. So my answer to your question is, I'm not sure we have learned enough from chikungunya or dengue or Zika that will help us against COVID. Felicia, can I just answer one question that came up pretty early, because I think it's a really important one.
Of course.
There was a question on indigenous populations, because as you saw a relative risk of 5 times higher in prevalence of antibodies in indigenous population. And someone, sorry, I missed, Arthur asked.
Arthur Correa.
Yes, Arthur asked whether there have been reports of government people going to isolated tribes and nations and contaminating people, infecting people. Regarding our study, number one is it's only urban areas, so we don't go to any isolated indigenous reservations. Number two, our field workers are tested and tested and tested. So the reason we didn't quite make all examinations in this last round, we are short by 50 exams from our target of 33,250, is that in one of the cities, all of them tested positive just prior to starting the field work. And so we had to remove that team from the city. We put in more people in the city, but by the time the whole sampling was affected. Our field workers, in addition to be tested, they were individual protective equipment. They changed their overalls and their clothes and face masks after each visit. They were really, really extra careful about that. Everything is disposed as hospital garbage. So we're really worried that we could involuntarily be helping spread the disease. And I think we're quite confident that this is not happening with our study. But to answer your question, yes, there's always a possibility that a government worker or even a research worker who goes to an isolated tribe may bring disease. Unfortunately, this is the history of colonization in our part of the world.
There's a second question also from Arthur Correa, and then from an anonymous attendee, and I think they're potentially related, and I both want to think about them, Cesar. So Arthur also asked, what would you say are possible ways to counteract the disinformation efforts being led by the government in Brazil? And how do we encourage people to listen to the evidence instead of dismissing it as fake news? And the other attendee asked, what is the role of civil society in educating the public about COVID avoidance initiatives?
That's again a very good question. I can tell you what we did. Remember, the first round, we wanted 33,000 interviews. We managed to do 25,000 interviews were arrested, tests were destroyed by the police, and so on. Unfortunately, Brazil, we have this idea of Brazil being a friendly, open society, a gentle society, and this is no longer the case. It's a deeply divided country along ideological lines, and again, along social lines as well. And the question that what helped us get a higher number of interviews now is that we used a number of different approaches. So we actually found out in the names of the health authorities in each city. The Catholic Church, speaking of civil society, has been very, very helpful. The network of the Catholic Church, mainly through one of their Catholic Church sponsored NGOs called the Pastorate of the Child. Every bishop, every priest in the country knows that our people are coming to their city on day X, Y, or Z to carry out tests. So we did, and we also have a very good support from the media. As you can imagine, every time we do a new round, we're on the main news in all the networks with results. So people are much better knowledgeable now about the study. Now, the hard part of your question is about disinformation in general about COVID. And that's a tough one. You know, it starts with how we count deaths, how we count cases. I see there's another question about there was a change in the government methodology of counting cases, but then 8 or 9 of the big media companies, newspapers, TV networks in Brazil got together and they started a parallel system of counting cases by contacting people in every city. They have network, they have reporters everywhere. So I see there's a healthy, very healthy response from civil society in terms of trying to tackle the epidemic. I'm not speaking about the small-scale NGOs who are providing food to people who cannot work because of lockdown measures. I'm not speaking of NGOs who are making masks and donating that to in poor communities. There's a huge effort towards that in many places. I'm not only speaking of those, I'm speaking there's a whole engagement of many different parts of civil society in responding in a better way than the federal government has been responding so far.
So I was just thinking to add to that, Cesar. I think it's been very hard on civil society. I have the privilege of leading a small NGO that works on women's cancers in Mexico. And what I've been thinking a lot about is in countries like Brazil, Mexico, and the United States, where leaders are not giving evidence-based messages. Right? We know that one of the lessons of health education is that we want people to have one correct message, 2 correct messages repeated over and over, not a whole series of messages. Yes. It's not up to different members of civil society to understand what is the best set of messages and measures. It's up to those organizations to help to transmit those messages to their own audiences. And so there, just to say, I think how important it is that if you can't look to your own leadership, look to our global health leadership. So the messages that are going to come out of the Pan American Health Organization, for example, should be a solid set of messages that we can take forward to other audiences, rather than trying to think that that we necessarily have those messages on our own. The messages from leaders like yourself in epidemiology and global health, take those forward, because we do, each of us who work or lead NGOs have our own audiences and ways to move those information through to the populace. And so that, I think, is a very important role that's being sort of pushed on civil society in some of the countries in which we work. We have another question now. What is the impact of COVID on the diagnosis and treatment of other diseases in Brazil? Is there a decrease in healthcare for other causes?
Absolutely.
And thus a potential medium-term impact on morbidity and mortality? And I'll relate it also to another question that we have from Claudia, who I know is a member of the board of the International Association of Hospice and Palliative Care, around what do we know about how to support particularly elderly patients who have strong mental health issues in the face of this disease, patients with dementia. Anything that you could comment on that, Cesar?
Well, the whole health services in Brazil have been terribly disrupted, and it's not only in Brazil. For example, vaccination rates are way down, the number of vaccines provided, because people are afraid of leaving home and going to a health facility where they may catch COVID. So I think and that affects hypertension, diabetes, cancer treatment, mental health, of course. Everything is being disrupted. It's going to be it's a huge natural experiment in a negative sense of the term, that we will have many years to understand and to measure how it impacted all other sorts of diseases. I think healthcare, healthcare basically is not working. It's working for people who have COVID symptoms, who want to get care, maybe go to a hospital, get to intensive care unit, but everything else is being postponed or stopped and discontinued. It's a real incredible tragedy. The deaths will be counted in numbers that go well beyond COVID deaths, because other diseases will certainly increase in terms of mortality as well.
I think this leads us into our next question from David Biller. I think the point is that we're beginning to see, particularly in the poorest countries in the world, a terrible set of choices, which is between increased hunger, suffering, and poverty of families who are already tremendously impoverished, which puts them at greater risk of other diseases, and shutting down of the economies. And this has become, I think, a torturous question, particularly for poor populations across our region and more so in many other regions of the world. And the question from David is basically asking that cities and states are reopening even with the number of cases and deaths still going up. Is your impression that governors and mayors are ignoring the indicators that should oblige them to keep things closed for longer? Are they looking at the wrong indicators? Let me just jump in for a minute there, because we're sitting in South Florida. Right. So I think some of the things we can answer in communities and countries that have the luxury of being able to support their population with income supports to be able to make it through strong physical distancing policies and not open up wholesale in the moment and when cases and deaths are rapidly on the rise. We have that luxury in a place like Florida, and we're not doing that. But also it's a combination of what our leaders are saying and what we as individuals should be doing, responsible individuals with our community. If you haven't seen it already, those who are listening, read Atul Gawande's New Yorker from a few weeks ago. It is clear that we wear our masks to protect others around us. They wear their masks to protect us. Those two things, plus distancing and hand washing, can truly protect us and allow us to safely open our economies. This is a public health lesson that needs to get out. And I would go so far as to say that it needs to be mandatory and obligatory. But let me turn it over now to Cesar and Mike for their comments on this question.
Yeah, let me follow up just briefly, and then I'll pass it to Cesar. Sure. There's a false dichotomy discussed at all sorts of levels of government in lots of different countries between lives on the one hand and livelihoods on the other. The idea that you must open up for the economy and absorb deaths that will come from the virus spreading, or you save lives, but economic ruin is what follows. As Dr. Knaul was saying, economies are opening up because economic ruin is already here, but this can be done safely. Wearing masks, staying apart from one another, testing and tracing, if at all possible, are ways to open the economy and save lives simultaneously. So it's not a question of either or at all. And we're seeing that in responsible places and seeing it less in places where both population and leaders are behaving irresponsibly.
Yeah, I have very little to add to what Felicia and Michael said. Obviously, my feeling is that a number of cities in Brazil are opening up too soon because there's strong pressure from the business sector as well. And you know how influential business people are with politicians in many places of the world. And that, in addition to the chaotic leadership we're getting from our president, that really confuses people, and that makes governors and city mayors, who on the whole have been very responsive to the science on the whole. You know, I think that's what Michael has been telling us as well. You know, the federal government goes one way, and often the state and city governments go in the other direction. The Supreme Court in Brazil has ruled that lockdown, mask use, you know, relaxation measures are under the discretion of governors and mayors, not the presidents. So that's a positive ruling. I still think that in many places, people are opening up too soon. Like Sao Paulo and Rio have both relaxed the number of the social distancing regulations, and in my view, that is too soon. But, you know, we have to wait and see.
And we're almost out of time, but we have one last question from Mariana Oliveira. To you, Cesar, Professor Victora, how do you think we can better communicate research results to civil society so they stick to measures to reduce the disease spread?
Well, we've been having, you know, I know there are several journalists here in the audience. I think the media in Brazil has been fantastic. You know, they have stepped up to collect their own numbers of deaths when the government decided to change the way they were counted. COVID is the main item in the news every night, along with the political scandals, which unfortunately remain very, very common. But I think we as scientists, you know, we have the responsibility, number one, to collect good data, to disseminate the data, to make them available in a language that people understand. You saw the infographics that we sent to every city shortly after we finish each round of the research. We say you have so many cases, it's going up, it's going down. Your deaths are, your cases, reported cases are underreported or not. And you know, that I think we have a real responsibility, and we have a great partner, which is the media. And also Brazil has a strong civil society infrastructure. You know, for many, many years, there are many different kinds of NGOs and many kinds of interest groups, groups of different types of people who are also playing a huge role. So although you know, we're sort of we've been fighting this information by some authorities, we're also being supported by the media and by civil society to a large extent.
So I might add to that, it's our responsibility to walk the talk. We need to make sure that we use our masks, that we practice social distancing, that we can help to show the example of how we can behave to protect others. And I think we also need to be extremely careful of the temptation is to try to give good news, to say such and such an intervention, such and such a medication, it seems to have a lot of potential. We have to stick to the evidence, the published evidence, the evidence that's gone through appropriate trials and considerations before we share any of that with the population. The reality right now is that your best bet is prevention, right? The reality is not to encourage families to spend their money to risk catastrophic spending on interventions that will not change their risk or change the risk of others. And I think there are some very responsible messages that we can share from civil society, from academia, about what not to do, and just to hold out while we're getting more information. You know, I'll bring us to a closure now. Let me ask, before thanking you, Professor Victora, Cesar, Mike, if you have sort of 1 minute of short comments. Mike, do you want to go first, and then we can give the last word to our guest speaker?
Certainly. Thank you very much. Political polarization coupled with mixed messaging at different levels of government in the pandemic is a terrifying recipe for disaster. This is what we're seeing right now in Brazil from a public policy standpoint. The lack of federal leadership, states take the lead, cities take the lead, but they don't have the resources of the federal government. And it's easy to mix messages, which is part of what we were talking about in the question and answer session. People need clear messages for how to act safely and how to protect one another. And regrettably, they're not getting a lot of that right now in Brazil. They're not getting it in many other places either. But this is essential for combating the pandemic, and we hope to continue to track these responses at different levels of government and report back as frequently as we can about what's happening, where it's happening, and who's in danger. Thank you.
Thank you, Michael. I just have one last thought to share with you. I think, this discussion has been fantastic. There's one thing that I wanted to highlight is that the role of scientists. And we are fortunate that in Brazil, for the past 20 years, we have had governments that supported science and have supported public health. We have almost 100 public health postgraduate programs in the country right now. And so when we want to do a massive piece of research, which is, by any account is terribly ambitious, and such as that we did, we have support from that results from this investment in public health, this investment in science that took place in past governments in the country. And the same is to be said for our national health system. It is under stress, but it is still one of the best health systems that any low or middle income country or even high income countries can have, with universal access, a very extensive primary health care network throughout the country. So we would be doing much, much worse in Brazil had not previous governments invested in not only health care, but also in science in the field of public health. Thank you very much.
Thank you, Cesar. You led me into, really say the same for Mexico and several other countries in the region. We may be living through a time when many leaders aren't interested in evidence or facts or using them, but we're always looking for, hopeful messages. And I think one thing that we've seen is investing in education, in people's education, in having scientists and having well-trained physicians in countries like Mexico and Brazil. That is long-lasting. That will survive almost any government, whatever that government's attitude may be or may not be. And so that's really the solid foundation on which a health system needs to be created and needs to be built. This has been such an amazing webinar. We are looking forward to continued and deepened partnership with you and with your group, and to be able to do more and more work on Brazil, to learn from you, to share in the region. This has been, I think, one of, if not the most enlightening of our series. I want to share with our audience that we will be coming back to you soon. Our next planned guest is Dr. Rafael Lozano from the Institute for Health Metrics and Evaluation, and probably one of Mexico's top leading epidemiologists, and one who's done a tremendous work at the subnational level in Mexico and throughout the region. I want to leave you with some, I think, hopeful messages. That is, while the projection of deaths in Brazil is very high, 166,000 by the beginning of October, what we're also seeing are projections that if social distancing is in place, that will avoid an almost doubling. We're also seeing a 10 to 15% projected reduction, and I think that's an underestimate of the use of masks and carefully managing our own entrance into society, each and every one of us, of course in Brazil, in order to manage this disease better. So there are many things that can be done by each of you as individuals, as academic leaders, your voice, and we are thrilled that you were able to join us today. I will also say that on behalf of the university, on behalf of our president, Dr. Julio Frank, who is a public health specialist, trained in epidemiology and health systems, how wonderful it is to be able to have this partnership and work throughout our region towards what is a better future. We invite you to visit our website, send us comments, continue to send us questions and answers. Again, the taped version of this will be available online by tomorrow at the University of Miami Institute for Advanced Study of the Americas, and we look forward to your continued participation in our research and our webinars. May you have a good afternoon, evening, morning, wherever you are in the world, and thank you again.
Thank you. Bye, Felicia.
Thank you both.